We are back with Tonya Viars from Cone Health. She's the director of imaging at Wesley Long Hospital, and she's explaining what imaging is, what you need to know about certain procedures, whether it's mammograms or MRIs or CAT scans or whatever. So let's talk about this. We've heard so much about false positives happening during mammograms when women go to get them because they recently got their COVID vaccine. So what we know now, should women wait to get checked until a little bit of time has passed after their vaccine?
So most medical procedures and screenings can be done before or after COVID vaccinations or boosters. If you are due for a mammogram, we highly recommend you talk to your Cone Health provider about getting your vaccine and what that might look like. Some experts are recommending you get your mammogram before being vaccinated, or at least wait that 4 to 6 weeks after getting your vaccination.
All right. And for sure, if you got your vaccination and it's somewhere close to your appointment, you should just tell your provider.
Yes, most definitely. It's very important for you to get back on track with all your preventative screenings.
Okay, and so, and there's a reason for that, so they'll know if there's some inflammation there that's not really there. So if someone delayed, let's say, their mammogram or some other screening, right, because of COVID, should they call the screening location directly now for an appointment, or do they have to kind of go through the steps?
So you do have some steps to take with that. You should contact your healthcare provider immediately. Referrals are required for that. So if there's a specific location that's going to be convenient for you, I would also recommend sharing that with your provider.
Yeah, because they don't know where everybody lives, right? So often, your provider will be like, well, you're going to go, and get it done here. Without thinking that might be a hardship. Again, talking to your provider and saying, hey, is there another spot, is a good idea. All right, so let's talk about the difference between a screening mammogram and a diagnostic mammogram.
Yeah, there is a big difference. Screening mammograms are usually more preventative. And while your doctor may also order a diagnostic mammogram looking for signs of breast cancer, a diagnostic mammogram is typically more detailed than a screening mammogram. Diagnostic mammograms are typically ordered if you find suspicious results on your screening mammogram, or if there's some kind of signs or symptoms that you might have breast cancer, a physician might take those extra steps.
Now I have a question. Is a diagnostic mammogram and a 3D mammogram the same thing or two different things?
Those are two different things as well. And it really is based on what your provider is looking for. It's going to be based on what he orders for you. Most of our care is very customized to the patient.
Okay, gotcha. All right. So now what's the difference between a CT scan and an MRI? Those things get thrown around all the time. So when should someone get a CT scan and when should someone get an MRI?
So before we even start that one, I'm going to say you definitely want to talk to your provider about these. They are going to be the best at choosing what's going to be the imaging service you're going to need. So while CT and MRI a lot of the times are very interchangeable, the biggest difference is that MRI uses radio waves while the CT uses X-rays. So MRIs are especially useful in spotting injuries like musculoskeletal conditions such as cartilage loss, joint inflammation, spinal injuries, torn ligaments, and a lot more stuff. But CT scans are much faster than an MRI, and they're useful in spotting blood clots or bone fractures, lung cancer, and really the choice is going to depend on your provider, what they're looking for, any contrast allergies that you might have, or even your compatibility with our MRI machine, because we have to remember that MRI machine is magnetic.
Okay, and so that means that some people can't have an MRI because of that.
That's correct. Depending on what type of pacemaker they have, if they have some, or if they have metal that's embedded in their body, that's something we do when we screen a patient for MRI. So it usually starts with your provider, and we make sure we have lots of backups to that.
Okay, so all of these things, mammograms, MRIs, CTs, all that kind of stuff, you take them and then you wait, right? So how soon can someone expect results from medical tests like these?
So most of the time, your doctor receives those test results in less than 24 hours. The person performing your exam, they get it done as quickly as they can. The results are usually available in your Cone Health MyChart, which is a secure online health record, but it is usually less than 24 hours when they result.
All right, and this is important too, because like if a healthcare provider says that you need a scan or a test done, does that necessarily mean something is wrong?
Oh, no, not necessarily. These medical tests really are just tools to help you with your health and well-being. The pictures really just give us and your providers what's going on inside your body, changes that may or may not have occurred. And they're really to help you with your treatment plan. I mean, if you have any questions or concerns, you should definitely talk to your healthcare provider. That's why we're right there with you. That's what it is really talking to them, and they are going to be there with you through the whole process.
Sometimes it's to eliminate something so that you know, oh, that is not what is wrong with you. All right, we've got about 30 seconds. Anything quickly else that people should know about medical imaging?
I think it's very safe. We do a lot here. We have a wonderful team. We are one team. And I am, again, going to say we've got so many locations that are going to be convenient for you. So really talk to your healthcare provider about what location is going to be best or most convenient for you and your family.
Right. The tests are already kind of stressful. We don't want traveling to be a stressful thing, too. There are options out there. Thank you. All right. We don't want you to miss any of this information. In a few minutes, we'll have it posted to our website in the To Your Wellbeing section.